what I'm real as a Health Forum member, what I'm proud of is intervention that we did for the community of Gugulethu. Not community of Gugulethu per se, and the surrounding areas. Here we managed to be a part of the crime intervention when the gangsters were fighting. Our children were fighting. They even kept each other from going to school. And then all the women, we call a meeting and decided that in the morning we are going to wake up and so that we can accompany them to the school. It's where we find out that these kids are taking drugs before they went to school. So we go to those drug dealers or taha, selling taha muffins and trying to talk to them and ask them. I can understand one of the guys was very mad about us and telling us that it's legal now. You cannot come and say I mustn't sell taha, you know. So because it's good sometimes when these kids are fighting, you check what is the cause of the cause. Oh, Sanders, may your soul rest in peace. The cause of the cause was the taha that they took before they went to school. We've managed to do intervention, so there was no fighting anymore in Gugulethu. Another thing that we are proud of as Gugulethu Health Forum is the intervention also pertaining to itaha and rescue our senior citizens that are really frustrated under their grandchildren. You know, there were two of them that we visited in the senior club that were saying we don't even want to go home because of the issue that we must face when we go home. They enjoy to be in the senior club, not going back to. We went there and addressed the senior citizen and asked them what are the problems. This woman will say, I'm getting my money on the 1st of the month, on the 2nd of the, and buy kettle and iron. Then the next day I don't have kettle because my grandson will take all those things and go sell it for eat drugs. So we've done intervention, not us. We refer. We went there at NY97 and go talk to those kids and ask them if they want really to leave drugs, because you can do intervention if it's not that person that wants to say, okay, I'm tired of using drugs, you cannot do nothing. But we went through Realistic and Crystal and send them to what is this place in Hout Bay? Tukai. They went to Tukai for intervention. So that's one of the things that we've done as Gugulethu Health Forum. We were part of no looting program as Health Forum when it was started to other provinces. So here at Gugulethu, we were part of the meetings that were patrolling at the night in our malls because they were starting to break in the mall, but every night we organize neighborhood watch. That's the importance of working and networking with other structures. You don't have to work hard as a Health Forum. You refer because there are neighborhood watches, there are CPF, there are child protection programs. If they will come across with the problem that has to do with the children, you just refer. You know, what is good about us, we've mentored Abo Andiswa that they are doing child protection programs. They are inside eHealth Forum. So we've got all these sectors. If there's problem, we just refer.
I'm also assisting the community whenever somebody is defaulting at the community. Maybe he's supposed to go last month to the clinic and he misses date. I'm also there to come and do appointments for the clients. Even when somebody is sick, at any time at night, they knock at my door for assistance. Like now, recently, there is a child, my neighbor, who drank some 7 tablets. She was trying to kill herself. I was on toes. That poor young lady come on me to knock at my door to assist to the clinic. I take the child straight away to the trauma. The child was assisted. The child now is all right, is healthy. I get all those strength and energy from the Health Forum information.
When I came on board to be a health forum, not a health committee, a health forum, that was in the early 20s. Mrs. Mabuzela was still the manager of the facility. What happened there is that there was a guy who was a security, was shot dead at the gate. And before that, we were crying as the health forum that there must be a police mobile. No, they didn't care about what we were saying, but we were keeping on. We want the police mobile, we want the police mobile. At last, we got what we've asked. But at the end of the day, we, the people who fought for the police mobile, we were put aside. The people, those people who are now like his community leaders, they are the people now who said we were the people who were fighting. But it starts with the Health Forum.
The family I'm talking about, their relative passed away, and there was a need to have the medical information of the deceased, and the family was struggling to get this information. So they were put between the pillar and the post. They have to go the other side, and when they went to that health center, they were referred to another center to get this information, and then they brought it up to the forum. So the forum was able to intervene and to find the conclusion to the problem.
We as a health forum, we also intervene, especially to those people who are selling drugs to our kids, by toying through to their houses, calling police. So then they must go and search, because these people are just killing our children's future. And at the other hand, on children's side, busy with the children to put them to the rehabilitation, which are here in our community. And another time we did wake up as women one day after we have a meeting and go to all these places where they sell these dacha muffins. Because there was a Rasta place who was selling dacha muffins, and we go there and monitor the children. And one of the children go to other places who are selling dacha, and we walk after those children, taking the children to school and go to all those corners where the children smoking. That's where we get our children.
There's also a thing of the folders. People who are HIV, their folders are putting in plastics. Those people who are not HIV, their folders are just like normal. And we said, you are discriminating now. You can't do that. We are equal. You can't treat people like they are not human beings. We are human beings. You must treat us equal. And they listen, and they also got their own window to go and collect their medication We fight for that, and we won't.
There's always a challenge for us, to get even the physical access to we would notice that even at the dispensary, the window is high up, those who are using wheelchairs cannot reach up, because they are high. They are not up to their level. So with the assistance of the Health Forum, we once had a rolling march as people with disabilities, and we went to the health center to demand that we are there as well. We need recognition. We need things to be made accessible for us. So yes, I am happy to report to you that even the waiting time when a person with a disability is attending the clinics is minimized now, because of the intervention of the forum. So accessibility is very important for us as people with disabilities.